have conversation and make a decision around COVID protocols moving forward until we can review them later down the road. I want to, of course, thank you all, the community, for your advocacy, for being here today, for reaching out to us and making your voices known. And I have to thank my colleagues sitting around me for your advocacy, for pushing me to have this special called meeting to make our voices heard and to have a conversation. More than anything, though, thank you very much, Dr. Battle, for your flexibility and continuing to lead this district. With that in mind, I'll kick off the meeting by asking you for your recommendation, and then I'll set ground rules for our conversation, and then I'll open the floor for a motion. Thank you, Dr. Battle.
Thank you, Madam Chair. Thank you, board members and the parents and members of the public who came here today. You know, we all wish that our focus right now would not be on face coverings or COVID protocols, but on how to make sure every student is known through our innovative programs in place to accelerate learning progress and the support our students need around their social emotional needs. It is my hope that we could allow students, their parents, and our staff to make their own personal decisions about wearing masks while still being strongly encouraged. Unfortunately, despite widespread availability of vaccines for everyone in our country aged 12 and older, for many months, the COVID-19 virus that seemed to be waning just a couple of months ago has now surged to their levels from before the vaccine became available. This was preventable, but society failed to prevent it. The Centers for Disease Control and American Academy of Pediatrics, along with other public health officials, have released guidance indicating universal masking is a priority in K-12 schools, especially in parts of the country like ours where vaccinations are lower than they were or should be or could be at this point. Now, Mayor John Cooper has issued an executive order requiring masks in all Metro government facilities starting today. As we are a part of Metro government, I ask that the board consider the mayor's executive order and setting a policy for MNPS students going into the new school year. I would recommend that we adopt a universal masking policy in keeping with the mayor's executive order and in an effort to best protect our students, staff, and their families from the spread of COVID-19, especially those students who are not currently eligible to be fully vaccinated. With that, I'll turn it over to you, Chair Buggs, and the board to discuss among yourselves about which protocol you feel would best protect the students, staff, and families of our MNPS community.
Thank you for that information and recommendation, Dr. Battle. I do want to note that one of our colleagues is out of state, and per our charter, she is allowed to both weigh in on the conversation and vote. Emily Masters, can you see me here? If you have a question or when it is your turn to speak, if you would just raise your hand and I'll be sure to acknowledge you. All right, with that, we have 1 hour because this is the middle of many people's workday, including myself and many of my colleagues and Dr. Battle and her staff, as well as community members. So we will have 1 round of conversation per person. You will have 5 minutes to speak, ask your questions of myself or Dr. Battle, and then we will move to the next person. With that in mind, I will entertain a motion. Vice Chair Rachel Ann Elrod.
Thank you. All right. In response to Mayor Cooper's Executive Order 21 and the recommendations of the CDC, AAP, and Metro Health, I move that MNPS adopts a universal mask policy, that all persons indoors and or on MNPS buses be required to wear a cloth face covering or a mask effective Friday, August the 6th, 2021. The Director of Schools is given direction to design and implement alternatives to this directive in order to appropriately meet the needs of MNPS students, employees, or members of the public while providing reasonable access to educational services, facilities, and other governmental services. The board will reassess this mask requirement under our given authority and with guidance from the health department when all Metro government issued mask requirements end.
All right, we have a motion. Do we have a second?
I'll second it.
All right, we have a second from Jeannie Pupo-Walker. I'll open the floor for discussion. Free-to-Player Peters.
I stand in support of the motion. For me, this is akin to secondhand smoking. When you're in a society, secondhand smoke can affect other people in the room. While you want to do it in your home, outside, that is your right, but we have to protect our children. A year ago, I said that we can't control what happens outside of school property. Our job is to keep kids safe, to give them an education, and that's our sole job, is to have a safe environment for our children to be educated. And so I'm supporting this mask mandate for that reason, to protect our students, protect our employees, so they can have a safe environment to have an education. I do not want to go back to what we had to suffer this past year. The only time I want to hear about school closings is if there's an ice or a snowstorm. So this is my goal, this is my intent, and that we're here because children under 12 cannot get vaccinated. You know, we had 2 children at La Bonner Hospital die of COVID. Trousdale County had to quarantine almost 100 kids because of exposure to COVID. There was Marion County in Arkansas had to quarantine 400 kids. We do not want to go that. We have to have kids in school. We have to educate our children, and this is the safe way to do it. So I'm supporting this motion.
All right, thank you, Mrs. Player-Peters. Any further discussion before we call? Go ahead, Mrs. Tyler.
Yeah, I just wanted to say that whenever a constituent has emailed, I have emailed back and said that one of my goals is to do everything in my power to open schools in person and to keep them in person with as little disruption to students' learning as possible. So whatever it takes for us to keep our kids in-person learning, focused on what they need to do to make sure that they are where they should be academically, then that to me should be the highest priority of the school board. We are not medical professionals. We are education professionals, and our job is to make sure our kids are learning. And keeping our kids in the schools is going to keep them learning best. And my only other concern, Dr. Battle, that I would want to make sure that we're thinking of is for our youngest learners. I know that phonics learning, there's a lot of concern around, and being a previous first grade teacher, I am concerned around our kids being able to see the voices, the facial motions that sounds really weird, when somebody speaks, to be able to understand the shape your face should make as you pronounce this letter and this word and how it looks when you put it together. So I would like for us to consider the potential of maybe like a clear mask for a small portion with a small group, or something where our kids will have the opportunity to see that physically, whether it is the masks that have that empty space or that clear space where they can see that, because that is a large concern of mine, in particular, just with those young learners figuring out how to read and not being able to see what's happening can be problematic. So that being said, I do think that following the recommendations that will keep our kids in school is the most important thing. But within those recommendations, I would like for us to see if we can have a little bit of flexibility on making sure that we're meeting people's needs individually.
All right, thank you, Mrs. Tyler. Further discussion before we move for Mrs. Bush?
Yes. I just want to make my comment and my statements. When I woke up on Monday morning to see your text to ask for a special session, I was really concerned that it would turn into just this, politics and all about power. The plan was to give parents, teachers an option, a mask option, and that was the plan. And we finally had a plan in place so that our children could go back into the classroom with little to no issues of having some normalcy. That was the goal, just to have these kids to have some normalcy, to go back into the classroom. Right now, we don't have any data to support this uptick right now. I'm saying right now. We don't have no citywide mandate right now for masks. We don't have a state mandate for masks right now. And I just can't understand why we continue to pounce on our metro school students when they can at least have some type of normalcy to go back into the school year this year before it even gets to a point that we may have to make some other recommendations. And to Abby, to your point, I do have a concern with those little ones that need to see their faces, our teachers to see their faces, so that they can be able to articulate and have the phonics support that they need, because it's going to be simply impossible for those little ones to be able to do it, especially when you have kindergartners that are going into first grade and don't have any idea of how to read or write right now. We have a problem on our hand. And if you want to talk about going off the recommendations of the AAP and the CDC, last year, I remember them making the same recommendations of getting them back in school. I remember our kids going through so much trauma. I remember that mental health was on a rise like we've never seen before because our students were out of the classroom. I remember all so well about all the suicides among our kids that happened, that we lost precious lives. I remember when we had over 25,000 students truant with no support. I remember how many children failed last year. Did we have a special session for that? Did we have a special session for that? Now, I believe in safety for our children. I've never said that, and I've never wavered about safety for our children. We need to start giving the power back to these parents. These parents are tired of us making a medical decision for their kids. And in this instance, we should have allowed them to have the opportunity, and I respect everyone's views. I have read all the emails. I have been able to respectfully talk to parents and teachers, but it's about choice. If parents and teachers, or teachers and students and parents make a medical decision within their household, that's not for us to do. We're not medical doctors. We should not be making medical decisions based on our views. We're here to keep our kids safe. That's not what I'm saying. I'm saying that we're trying to make sure that we are giving families options. And this plan, we finally had a plan, because last school year, we didn't have a plan going back into the school year. We had someone on the committee to make a high recommendation to get these students back into the classroom last August. And as we all remember, we asked families to take surveys on either going back into the classroom or staying virtual. And we didn't even follow that plan. So finally, when we have a plan, then here we go again, wavering on a way to cause more harm than good. Because this is about parents, this is about children. This is about taking away their power. And we did it last year, and we're doing it again this year. We could have gone back into the classroom safely. 18 months ago, the other counties that are touching us, they got it. They said it. We've been doing this for 18 months, and we know how to try to get this right for our students so they can have some sense of normalcy. And so every county that's touching our county are going back in with mask options.
Thank you, Mrs. Bush.
And I'm not taking away anybody's rights, and I still got time. I'm not taking away anybody's rights as far as what they choose to do. It is a choice. It is a choice. If you choose to put your child in a mask, absolutely. Absolutely. If a teacher want to go into a mask, absolutely. But those students who have health conditions or health risks, let them parents do that without doing a emergency exemption. They shouldn't have to do that in order to prove that this is their child and that they know their health of their children. So I am not voting in favor of a mask mandate because it shouldn't even be time to do a mask mandate. This city is open, citywide, no citywide mandate. There is no data to support any of this right now. There is not no state mandate, mask mandate. So why are we doing this to our children? Why are we doing this to our families when everyone has choice? All year long, either businesses have discontinued their mask mandate in their businesses, and some still have theirs installed on their doors. But when you walk into that business, if they don't have a mask mandate, you can have a choice to put on a mask or not to put on a mask. That is your option. And that's the option that's been given in this city. But every time it's about Metro Nashville Public Schools, we have a problem on making sure that we can give these children some sense of normalcy. And it has to
Mrs. Bush.
stop.
Thank
Thank you.
Further discussion? All right, without any further discussion, we will call for,
So one of my questions is,
Little?
and we're pretty divided. I mean, I've received over 100 emails, mostly in the last 3 days. And in my district, it's been, initially it was against the mask, recently it was for the mask, and so it's a lot up and down. And so one of the questions that have been asked, how are we doing with our virtual schools, like reopening it back up? And I was reading a Chalkbeat article, and it says the school's website states, please note classes are not synchronous with live daily interaction. And so one of my questions, I guess, for Dr. Battle and the team, will we have an opportunity to reopen virtual schools for families, especially since it's not going to be synchronous with live interaction?
thank you for that question, Mr. Little. I remember about 3 months ago at one of those board meetings, we found out that we applied for a waiver for elementary school virtual school and were denied by the state. So that's not something that we can do right now. Please,
We did add 4th and 5th grade to our MNPS virtual
right,
schools.
but not for K through 3. So we have virtual school that we've had for a little over 15 years, and that'll continue to be an option for families.
So right now, is registration still open is what I'm asking for families, Ms. Buggs?
Dr. Battle, do you feel comfortable answering?
Our choice process ended back in the spring, and our MNPS virtual school application process ended in June. So those processes have been closed, and we are full in our MNPS virtual school. But just like with our other processes, there are wait lists for students who do qualify given the number of seats that may or may not be available.
And I would say in light of this, because we're making a pretty quick decision, and I agree, like it takes a lot to staff and get ready, but based on our response, they're not going to be synchronous with live interaction between students and teachers. It says courses are constructed around modules and lessons, allowing students to work independently and advance at their own pace with the support and help of a highly qualified, certified, and caring teacher. And so since it's not going to be synchronous with live interaction, do we have an opportunity as we put this decision before parents to make quick decisions with, less than 5 days before school starts? Do we have the capacity? Maybe we do, maybe we don't. But I think that's a question that would, I know from my email inbox, calm the nerves of some parents.
With all due respect, with regards to preparing for and delivering on a quality educational experience for all students, there are many complexities that go into this, including ensuring that every class is staffed with a high-quality teacher, as you just read from the article itself. I want to remind us that our MNPS virtual school is a school that's been established for over 10 years and with success. So the model of learning there is pretty well research-based, right strategies, but we do have a student-to-teacher ratio that we also have to meet in our MNPS virtual school. So while all the classes are not asynchronous, there are strict requirements around meeting the individual needs of students, tutoring, small group, all of those things still happen within our MNPS virtual school. And so it would probably be a assumption that because of that, you can have higher class loads, and by state law, we cannot. There is a state student-to-teacher ratio that must be met. And again, we did extend the time of enrollment for our MNPS virtual school, just making sure that there was awareness and an opportunity for everyone who would like to enroll in their school option. Like our other optional schools, including our magnet schools, we will continue to roll off our wait list as seats become available. Keeping in mind that a seat available does not always equate to the grade level that a student might be currently enrolled in.
Thank you.
All right, thank you, Mr. Little. All right, Mrs. Masters.
Thank you. I just have a question about mask availability. Will we have masks, plenty of masks available at the schools for children who forget them or lose them?
Dr. Battle, would you mind?
Absolutely. In the same alignment to our policies and practices last school year, we will continue to provide masks for any student or staff member who needs them. So we have masks on site at every school, and we'll be able to provide them on a daily basis and even multiple times throughout the day if needed.
Thank you.
All right, thank you, Mrs. Masters. Any further discussion? Oh, Mrs. Elrod?
Thank you. Due to the current increase of the COVID-19 cases with a novel virus with exceptional contagiousness, it is disheartening, beyond disheartening for most, particularly that this is our third school year that COVID-19 has affected. And I understand how people are over it, but we are now dealing with the collective effect of being over it. And in order to keep our classrooms open and safe, I support us implementing these proven mitigation systems and strategies, and it would be negligent not to do so. I understand that there's a lot of politics surrounding vaccinations and masks, and I am not surprised to hear that even upon our own board, though continuously disappointed in it. And our decisions and guidance are to always be rooted in our joint responsibility that we have to the safety and education, to our students and families, and to the community and public health in general. And we are not to root those in some type of state politics, political threats, astroturf, or partisan groups. And we should require of ourselves the same things that we require of our students, which is critical thinking, credible sources, reviewing data, examining and scrutinizing that data, and of course, claim evidence reasoning, which we do. I know that last year was difficult. It was difficult for me not only as a board member, but as a parent. And I understand that it is, again, frustrating that this is another year of responsibilities and having to have a response to COVID-19. And I want us to continue to follow those recommendations that are needed. We responded to them last year. That's why we started school back in February, along with many other things. It is also why I think about 40 to 50% of our parents chose to continue to have their students virtual. There are lots of concerns, and our job is to make sure that we are protecting our students. We cannot teach them if we cannot protect them. And so I would like us to continue to follow with the proven mitigation strategies that are available to us, whether that's hand washing, contact tracing, school mapping, vaccinations being available, and of course, masks.
All right, thank you, Mrs. Elrod. We will continue to model appropriate behavior for the young people watching. With that in mind, Dr. Gentry, adults, please.
Thank you, Madam Chair. It's always interesting to hear that we have a plan when it aligns with what we want, and we don't have a plan when it doesn't align with what we want. But we do have a plan. And I do appreciate the thoughtfulness of Dr. Battle and her team in bringing forth the recommendation. I had an opportunity to speak with a group of physicians, and one physician in particular, last evening at an event. And wasn't medical, wasn't, as some of us have, really pointed out, we're not trying to be medical professionals. But it's very disheartening for me, and I've shared this with a couple of people, that we've gotten away from thinking like a society, and we're thinking like tribes and individual pods. And we are willing to forego the greater good for individual preferences, which you have a right to. But our responsibility, as Ms. Elrod has pointed out, that as a collective, we have a responsibility to the greater good and not to the leanings of individual preferences that we all have for our children. It's this balance that we have to find between rights and freedoms and actual justice, was how it was actually articulated to me by a physician last night. We were all disheartened and expressed our condolences and emotions around the suicides due to being at home, is what we were told. The truancy rate because children were not logging in or able to log in, so we were told. The scores that we will have future discussions about, having children trying to learn in a remote setting without the social and emotional supports that they needed, that human contact that is so important to how we grow and how we learn, and just being in the presence and in an educational setting. Because as I also pointed out, during that time, our classrooms were not equal. As we look across the city at the multiple versions of Nashville that we have and the varied conditions in which our students live, and therefore, by extension, were required to learn. It did not go well. It is not a topic we are attempting to avoid by not having a meeting about it. It is definitely a topic that will be addressed and discussed. But there's an urgency here. And we're choosing to not be reactive and waiting until there's a death or waiting until there's a mass quarantine requirement within any of our schools. Our responsibility is to what happens in our schools, not to what happens in your individual homes. So with that, Madam Chair, I'd like to call for the question.
All right. Mrs. Elrod, would you restate your motion?
Sure, 1 second, please. In response to Mayor Cooper's Executive Order 21 and the recommendations of the CDC, AAP, and Metro Health, I move that MNPS adopts a universal mask policy that all persons indoors and on MNPS buses be required to wear a cloth face covering or mask effective Friday, August 6th, 2021. The Director of Schools is given discretion to design and implement alternatives to this directive in order to appropriately meet the needs of MNPS students, employees, or members of the public while providing reasonable access to educational services and government facilities and services. The board will reassess this mask requirement under our given authority and with guidance from the Health Department when all Metro government-issued mask requirements end.
All right, it has been moved and properly seconded. All in favor, please raise your hand. All right. Have 8-4. All opposed? We have 1 opposed. Motion passes. Be there no further business, this meeting is adjourned. Thank you all for coming.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.